My name is Dr. James O'Donovan, and in this video, my colleague Ella Boys, a qualified physiotherapist, is going to demonstrate exercises that you can do at home to help with subacromial bursitis, which is when a small fluid-filled sac in your shoulder, called the bursa, becomes irritated and swollen. When it's inflamed, you might feel pain when lifting your arm or doing repetitive shoulder movements. For these exercises, you're going to require resistance bands, which I've linked in the description box of the video, and please remember to always consult your own health provider before attempting these exercises to make sure that they're suitable for you. So exercise 1 are wall push-ups, and the focus of this exercise is on the scapula. Facing the wall, stand about a foot away. Place your hands on the wall at shoulder height, fingers slightly extended. Next, begin the movement by bending your elbows slowly, bringing your face towards the wall. Aim to keep your back and your hips straight, then push back to the starting position. You want to aim to perform 10 repetitions and complete 3 sets throughout the day, which you might choose to do in the morning, the afternoon, and then the evening. Now, these modified push-ups help to strengthen the muscles around your shoulder blades without putting too much stress on the joint. Exercise 2 is a posterior stretching exercise. For this movement, you can be standing or seated. Begin by grasping the elbow of your injured arm using your opposite hand. Next, gently pull your injured arm across your body until you feel a light stretch in the back of your shoulder. You can hold this for 15 to 30 seconds to feel the stretch. You can repeat this movement up to 5 times. Now, with this movement, you should feel a gentle stretch and not pain. This helps loosen tight muscles and fascia on the back side of your shoulder. Exercise 3 is a behind the back stretch. Now, this is a more advanced stretch, so you should check with your doctor or therapist if you're ready for this. And I'm going to present 3 variations, each increasing in intensity, which Ella is going to demonstrate now. The first is a light stretch. For this, place your hand in your back pocket and let it rest to feel the gentle stretch. Next is a moderate variation of the stretch. For this, grab your injured wrist behind your back with your other hand, palm facing outwards, and next gently lift your hand upwards to increase the stretch. Finally, there is an advanced version of this stretch. For this, drape a towel behind you holding one end in your injured hand and the other end in your good hand in front. Gently pull the front end of the towel, moving your injured arm higher up the back. Now, you should hold each stretch for 15 to 30 seconds and repeat it 2 to 4 times, and always stop if you feel sharp pain. Exercise 4 is an overhead stretch. For this, begin by gripping a stable surface like a tabletop, a doorknob, or a chair back, roughly at arm's length. Next, bend forward with your arms straight and your knees slightly bent. Lower your upper body to extend your shoulders, and you can step backwards to increase the stretch. Hold this for 15 to 30 seconds and repeat it up to 5 times. Now, this is a great passive way to open up the shoulders and relieve tension. Exercise 5 is a shoulder external rotation. Hold an exercise band with both hands at waist level, elbows at 90 degrees, close to your sides. Gently pull the band outward, keeping your elbows tucked in until you feel a mild stretch, and then return to the starting point, slowly bringing your hands back together. You can complete 8 to 10 repetitions and perform 3 sets throughout the day. Now, these exercises are key for strengthening the rotator cuff and stabilizing the shoulder. Exercise 6 is a scapular retraction. For this, secure an exercise band around a stable object at waist level. Here we're using a chair, and hold the ends of the band in each hand. Pull your elbows straight back, keeping them at 90 degrees and close to your sides. Focus on squeezing your shoulder blades together. Complete 8 to 12 reps, and as an optional progression, you could perform the same movement with your arms raised to shoulder height if your range of motion allows. Exercise 7 is a shoulder blade squeeze. For this, stand or sit tall, arms relaxed at your sides. Gently squeeze your shoulder blades together without shrugging up and hold it for 5 seconds. You can perform this movement 8 to 12 times, and this exercise helps improve posture and scapular stability, which are critical for overall shoulder health. Exercise 8 is an internal rotator strengthening exercise. For this, attach an exercise band to a doorknob, a chair, or anchor at your side. You can also place a roll towel under your elbow for comfort if you wish, and have your elbow bent at 90 degrees. Taking the band with your injured arm, slowly rotate your forearm inwards towards your stomach and then return to the start before repeating this movement 8 to 12 times. Keep your elbow really fixed into the side to isolate the internal rotators. Now in part 2 of this video, we're going to cover exercises after surgery which can help with rehab, and you should only do these when cleared by your doctor or physical therapist. So the first is shoulder forward elevation. For this, interlock your fingers or place your hands together at waist level. Gently raise your arms overhead, keeping your elbows as straight as possible. Hold it for 10 to 20 seconds at the top and repeat this movement up to 10 times. Now the tip here is to go slow and work within a comfortable range, so pain-free motion is the ultimate goal. Exercise 2 are supported shoulder rotations. For this, you can be seated or standing with your elbows close to your sides. Gently rotate your forearm side to side, moving your hand from one side of your waist to the other, and perform the movement in a slow and controlled manner. Next is the walk-up exercise. So, facing a wall, walk your fingers up the wall as high as is comfortable. Hold it for 10 to 20 seconds at the top and then walk them back down. You can repeat this slowly up to 10 times. Finally, there is a shoulder extension. For this exercise, stand with your back against a wall, arms by your sides. Place your hands gently on the wall and press backwards, feeling the stretch in your shoulders. You can hold it for 5 seconds and then relax. You can repeat this as many times as directed by your own therapist. I hope you found this educational, informative guide useful. If you did, please let me know in the comments section and do bookmark it and share it with others who you think might find it useful.